So today I did a soap note on my most interesting patient, who is a 56-year-old female patient named JJ, race Caucasian. Chief complaint: unable to move left side of the face and unable to close the left eye. So JJ is a 56-year-old female patient who presents to the clinic today with complaints of being unable to move the left side of her face and unable to close her left eye. She states symptoms began upon waking this morning. She describes the left side of the face as consistently numb with difficulty closing or blinking the left eye. Denies anything making the symptoms better or worse. The patient's husband states she slept well last night. Patient has a history of having the flu about 2 weeks ago. She denies any ear or facial pain, rash, alteration in taste, unsteady gait, and numbness or weakness to any other areas of the body. Patient states she has never had an episode like this before and denies any trauma to the head or the face, denies any recent travel. Prior to this morning, the patient has been in good health. She has no known allergies, no known food allergies. Her past medical history is anemia, GERD, and recurrent kidney stones. Family history: mother is 82, has hypertension, is living. Father is 84, has dementia, CAD, and hypertension, and is living. She has no siblings and no children. The only surgical history she has is kidney stones that were removed in 1990. Her social history: the patient currently lives with her husband of 20 years in a 2-bedroom home in South Florida. She enjoys aerobics, swimming, and biking. She's a dental hygienist, and her husband is an electrician. Denies tobacco or illegal drug use. Admits to social drinking occasionally on the weekends, having about 1 to 2 glasses of red wine with friends. Patient has no children or siblings. Patient sleeps on an average of 6 to 7 hours a night and eats a well-balanced diet and is physically active 3 to 5 days a week. Her current medications is omeprazole 20 milligrams PO daily and over-the-counter woman's multivitamin. For the review of systems: general, she denies any generalized weakness, fatigue, change in sleep habits, appetite, or weight changes, fever or night sweats. She does admit to 2 weeks ago having chills, generalized fatigue, fever of 101.5, and being achy for about 24 hours. Her skin: she denies any rash, open wounds, masses, or lesions. Her head: she denies trauma, admits some thinning and graying of the hair. Nose: she denies discharge or epistasis, and she admits history of seasonal allergies. Her eyes: she admits the left eye has weakness and dryness, and she denies pain, blurred vision, discharge, or visual changes. Her ears: she denies deafness, tinnitus, pain, or discharge. The throat: denies any difficulty in swallowing. And cardiovascular: she denies chest pain, any edema, syncope, dyspnea on exertion, claudication, or palpitations. Her respiratory system: she denies any recent respiratory infections, wheezing, pleuritic pain, or shortness of breath. She denies tobacco use or exposure to pollutants, and she denies TB exposure. Musculoskeletal: she denies generalized weakness, muscle or joint pain, joint stiffness, or limitation of movements. She has no history of arthritis, gout, or disc disease. She does admit of generalized fatigue and achiness about 2 weeks ago, which has subsided. Neurological: she admits left side facial numbness and weakness since this morning. Of the facial expression muscles: she denies an unsteady gait any generalized weakness, syncope, tremors, coordination problems, seizures, paralysis, or a history of stroke. So when she came in, her vital signs: temperature 35.2, pulse 62, blood pressure 118/67, respir 17, her height is 157 centimeters, and her weight is 112 pounds, all within normal limits. So her general appearance: she was alert, oriented, well-developed, cooperative, and interactive. Her head, ear, nose, and throat, she had asymmetry. She had ptosis of the left eye, widening of the palpebral fissure, which is cranial nerve 7 not being intact. Besides that, there was no other abnormalities. Her heart, the rate, rhythm, all normal. No murmurs, extra sounds, or palpitations. Sorry. Respirations, her lungs are clear bilaterally. No wheezing or crackles. No diminished lung sounds. The skin is all intact and no painful rash or lesions present. And neuro, she's alert and oriented, relaxed and cooperative. We did a detailed cognitive testing, which showed the cranial nerve 1. We didn't test, of course, but cranial nerve 2 through 6 and 8 through 12 are all intact with good muscle bulk and tone and strength. 5 out of 5 throughout, and a steady gait. Her reflexes were good too, with being a 2+. So based on this assessment, we came to the conclusion that we think that it's Bell's palsy, and our plan is within the first 72 hours of the symptoms, we'll start prednisone 60 milligrams PO once a day for 5 days, then 50 milligrams PO once a day for 1 day, then 40 milligrams once a day for 1 day, then 30 milligrams once a day for 1 day, then 20 milligrams once a day for 1 day, then 10 milligrams once a day for 1 day. And for the dry eye, because it's common, so during the day, glasses may be worn and artificial tears used as needed, and overnight eye lubricant should be applied and the eyelid taped closed. Eye patching should be avoided. And then we will follow up in 4 weeks to reassess the patient's symptoms. And that is my SOAP note on my patient.